Anaphylaxis is a life-threatening allergic reaction that requires a swift and coordinated response.
Absolutely. Every second counts in this situation. What are the first steps we need to take?
The initial steps are twofold. First, immediately remove the allergen if possible.
Okay.
This could be a medication, food, or insect sting.
Get the trigger away from the patient, then what?
Next, administer intramuscular epinephrine into the outer mid-thigh without delay.
Okay.
Epinephrine is the first-line treatment for anaphylaxis. There's no time to waste.
Epinephrine is the go-to drug in this scenario.
Yeah.
What if a single dose isn't enough?
If we don't see improvement within 5 minutes, we can administer additional doses of epinephrine as needed.
Okay.
We need to be aggressive in managing anaphylaxis, but we also need to be monitoring for any adverse reactions.
So epinephrine first, then what other supportive measures are crucial?
We also provide supportive care, including high-flow oxygen and intravenous access for rapid fluid resuscitation. This is especially important if the patient is hypotensive.
We're supporting breathing and circulation while the epinephrine does its job.
Yeah.
What about ongoing monitoring?
Close monitoring is critical for at least 4 hours due to the risk of biphasic anaphylaxis. This is when symptoms can recur even after initial treatment.
Biphasic anaphylaxis sounds like something I need to learn more about. That delayed reaction is certainly something we need to be aware of.
Yeah.
It seems like even when the patient seems to be recovering well, we can't let our guard down too soon.
Exactly. They still need close observation for a few hours to ensure the reaction is truly resolved.
But what about other medications like bronchodilators or corticosteroids? Do they have a role to play?
Bronchodilators can certainly help open up the airways, but they should never delay the administration of epinephrine.
Right.
Remember, epinephrine is our primary weapon against the life-threatening effects of anaphylaxis.
Right.
It works quickly to counteract that allergic cascade.
So epinephrine takes priority, and then we can consider adding bronchodilators if needed.
Right.
What about corticosteroids?
Corticosteroids help reduce inflammation, but their effects are delayed.
Okay.
They are not a substitute for epinephrine.
Gotcha.
Think of corticosteroids as a potential way to prevent a biphasic reaction or to manage lingering symptoms, but they're not our immediate go-to in the acute phase of anaphylaxis.
That makes sense. So corticosteroids play a role in the bigger picture.
Right.
But epinephrine is king when it comes to acute management.